my screen?
Yes, yes.
Okay.
Yes, yes.
Hello. Dis-moi pas.
A call to ensure access to human milk for vulnerable infants during the COVID epidemic. World Health Organization data confirm that there is around 3 million cases
Dr. Virgin, is
in the world of COVID, 1 million in Europe, and a lot of cases in France. In the most serious cases concern older people with comorbidity, hypertension, obesity. In the world, only 2% of people detect and contaminate with coronavirus are child or adolescents. COVID has been very rarely described in newborn, and evolution was usually good. COVID-19 and neonate. If a mother is COVID positive during pregnancy or during childbirth, the current data agreed with absence of transmission from the mother to the fetus. Obviously, risk of horizontal transmission via the emission of droplet emitted by one of the parents positive to the newborn. In that study, you can see that also grandfather could be positive and could transmit virus to the baby, and that distances, hygiene suggestions, wearing mask must be necessary. COVID in human milk. The presence of COVID is exceptional, while specific anti-infectious properties are found in large quantities. Its infectivity has not been proven to date. That study is the only one study who could prove detection of SARS-CoV-2 in human milk. But that one demonstrates also evidence of significant secretory IgA dominant SARS-CoV-2 immune response in human milk following recovery from COVID-19. COVID-19 and breastfeeding. No contraindication to breastfeeding, no viral transmission through milk, but barrier gesture must be maintained with hand washing before and after breastfeed, wearing mask, and surface hygiene with solution with more than 1% of chlorine. Mothers need to be informed about the importance of adhering to strict hygiene rules when they breast pump their milk. What environmental hygiene measures should be taken when collecting meat? Chin, in his study, demonstrates that on plastic we could find virus 6 days later. At 22 degrees, 40 days later, people have found also virus. And in 5 minutes with household bleach, with 1% of chlorine solution, there is no virus. Recommendation for milk collection. EMBA mentioned that COVID plus mother who are expressing milk must be facilitated to practice excellent hand hygiene and care must be taken to ensure that bottles containing express breast milk are not externally contaminated. Actually, recommend chlorine solution, but is it safe? In a further manuscript we submit recently, we have proven that chlorine solution for an efficient and safe method of decontamination of breast pump milk collection kits during and after the COVID pandemic. And that use chlorine solution for breast pump kits decontamination is safety, with a less health value of THM and chlorine. In conclusion, COVID and breastfeeding, no case of vertical transmission, maternal-fetal transmission, one case via breastfeeding milk COVID plus, very short varium and anti-infection properties of milk. Case of horizontal transmission through aero or manual transmission, if symptomatic during the breast setting, milk collection and baby care measure barrier or hygiene of the collection must be pursued. IgA and IgG protective antibodies in COVID mother's milk are present. What about human milk bank and COVID-19? In Europe, there is more than 248 active milk banks, 20 more planned milk banks. Human milk is vital for most newborn and must be delivered by human milk banks. SARS coronavirus are sensitive to heat. The SARS-CoV-2 is inactivated at 67 degrees for 16 minutes. Older pasteurization 62.5 during 30 minutes, which is carried out in all French milk banks, as well as other pasteurization protocol, allow to eliminate SARS-CoV-2. On the other hand, refrigeration and freezing do not seem to be effective on SARS-CoV-2. You can see on that figure the stability of SARS-CoV-2 and the efficiency of older pasteurization. Human milk bank in France and our experience in Paris fears on the 16 months about decrease in distributable milk, reduced enrollment with confinement, fear and collection, donor stress, difficulty in ensuring business continuity, COVID plus staff, lack of transport for our team, increased consumption of human milk bank with the difficulties transporting raw milk, mothers COVID plus with respiratory distress, not able to extract their milk. So the French Association of Milk Bank decision was to continue collection and pasteurization and distribution of human milk. Our stock beginning of the crisis was 260 liters, so only 10 days of distribution. The EMBA and the French Association position have been resumed, and in the recent Lancet manuscript, maintaining safety and service provision in human milk banking, a call to action in response to COVID-19 pandemic. And you can see that when a mother owns milk is not available, World Health Organization recommends pasteurization milk as the first alternative. Human milk banks screen and recruit donors and have wide-ranging precautions to ensure the safety of donor milk. Screening donor milk primarily feed baby of their low birth weight, protecting them from a range of complications as well as baby with congenital abdominal anomalies. Our experience in human milk bank of Ile-de-France in Paris in Necker Hospital, promotion action in hospital, radio broadcast, Parisian Perinatal Health Network, and Facebook. Dissemination guideline in health network, hospital, maternal infantile protection center about milk donation and COVID, and about breastfeeding and COVID. What is the result? A call to ensure access to human milk bank for vulnerable infants during the COVID-19 epidemic. We could see here in our publication that there have been an increasingly collect of milk with the epidemic of COVID. Human milk collect have been significantly improved, and it was a good news and happy hand for us.
Thank you for your lecture. Any questions?
And I just had a few fresh news about that. With the second wave, it's not the same situation. Probably mothers are more anxious. The mother go out the Ile-de-France to go in space, red space with green space, and we could see a decrease of our milk collection, with actually the more impression decrease from a few years ago. So I think that in fact COVID have a real impact of human milk bank. I made a call for milk donation now there is 3 weeks ago, and we have an increase of milk, human milk donor, and perhaps we hope that our stock will be higher in few weeks.
Thank you, Dr.
I don't know. Can I ask to Gillian in England what is the profile actually of human milk donation, and what is the curve? Is the curve at the same profile or not that in France?
Yeah. Okay. So we had the same response to the first wave. In England, well, in the United Kingdom, I shouldn't just speak of England, we've always been a few weeks behind the French curve. And certainly in the first wave, we didn't get the drop in milk donations that we initially expected. In the same way that you found, we found that particularly as soon as there was any social media and promotion of milk donation, that actually we got more milk than we needed. And after a very initial increase in demand to start off with, the demand dropped off from neonatal units. So our milk bank supplies quite a lot of hospitals, and initially there was an increase, but I think that was them wanting to get stocks of donor milk high in case they needed it. But then they found that actually there were fewer preterm infants being born, and that they didn't have the increased demand. But I think you're right. I think that this second wave is something different. Now we're just going into lockdown nationally tomorrow, and the
I think that your mother want to, yeah.
And the impact of the second wave hasn't hit milk banks yet, but I wouldn't be surprised if we find the same as you, that actually we need to work much harder this time on promoting milk donation. We're very fortunate in that some of the other challenges we were able to overcome them quite quickly. So for example, transport wasn't, the transporting, the collecting of the milk, all those things weren't interfered with. We found that we had, you know, plenty of milk, but we'll have to see. We haven't seen a drop off yet, but it's early days. As I said, we are a few weeks behind you.
And I hope that our experience will help you to anticipate probably the decrease. I think that a lot of mothers keep their own milk more than before the crisis, because they don't know how long does that will take, how long does, so they keep their milk to think that their baby could still be breastfeeding a longer time, and they are quite anxious because they don't know if they need to go to return to their work and how the baby will be surveyed. So a lot of mothers have no vision about the future, so they keep more milk for on the baby, which it's honorated, but I think that it's one of the reasons why we have less donation actually than from the first wave, which it was a new stage and new opportunity for them.
Yes, yeah, no, and when I heard you talking about the impact of the second wave, I immediately started to think, I wonder if this will be replicated anywhere else. We must put something on the Gamba group.
I think so.
Yes, do please. I'd like you to do that, because I think it's important. This is something that's you know, impacting on everybody again. And funnily enough, just yesterday we put out a call to all the UK milk banks to say again, you know, do we need to be talking for mutual support? Because I think this is an important thing at this time, that milk banks can support each other. You have a very strong network in France, but many countries don't have such a strong network. And if one milk bank is affected by staff illnesses or a sudden drop in milk intake, then it can mean that they don't have enough milk for their hospitals, and we should be able to support each other. The bigger milk banks can possibly support the others. But I agree with you, and in a way, it's a good thing if mothers are feeling, well, you know, maybe I'll hang on to my milk a bit longer before I donate it, because they may well be worried that if they get ill themselves. I think people's expectation, because it's winter, and because it's likely that the virus is going to be more easily transmitted, just because there are more coughs and colds and people are sneezing and coughing more, that they're worried that if they get ill, and that it will be good to have some milk. And I know if people get it, even just for a couple of days, they can be really feel so exhausted that just getting out of bed is difficult. So we shall have to see, but thank you for your warning. It's very timely.
So
I have a question. For Dr. Gillian Weber. In your first slide, I was not able to ask the question because we went for break.
Yes.
You mentioned about the impact of COVID. I just didn't understand about donor number and donor screening. So if it affects that screen, pardon?
Well, I'm very happy to explain more about that, and Virginie can explain too. So in terms of donor numbers, it comes down to what we're talking about now, that we were worried because to begin with, we had no idea if mothers would still be able to donate, if they would, because normally you have face-to-face meetings with donors, they would be reluctant to leave the house. They would be reluctant to go to their GP, their doctor, to have blood tests, or go to the milk bank to have blood tests. In the UK, we were able to arrange with the National Blood Transfusion Service that milk donors could go to a blood donation centre, which were all open, and that they could have their bloods taken for their serology tests at a blood transfusion center, which was new and which was a good thing, because actually going forwards, that's an important connection between the two services. But that's what we were worried about, that before we can use anyone's milk, before we can accept someone as a donor, we've got to be able to, if not meet them, preferably we like to meet them, but somebody has to meet them to pick up the milk. They have to be able to get their bloods taken. Milk bank staff will go to the donors' homes to take their blood if they can't go anywhere else. But as I said, if they're reluctant to have this face-to-face communication, then it just made it that much more challenging to be able to recruit donors.
Okay, thank you.
You're welcome.
For the next presentation, it's a good, there is a good relation between the two ones, because there